We've been around since 1979. There were two mothers who had children with schizophrenia who formed the organization because they knew they couldn't be the only people around that had children that had a mental illness. We also cover, in addition to depression, bipolar disorder, schizophrenia, schizoaffective disorder, obsessive-compulsive disorder, post-traumatic stress disorder, and borderline personality disorder, as well as co-occurring brain and addictive disorders. We don't cover dementia, autism, and Alzheimer's. Mental illnesses are brain disorders. A brain is an organ in the body, so mental illnesses are real medical illnesses. And about 1 in 4 people is affected with mental illness, either having an illness themselves or a family member who does. So if we have about 50 people in this room, there's a good chance that a little over 10 people in this room either have a relative with a mental illness or who may have a diagnosable mental illness themselves. The rate of depression is about 10% for men and about 20% for women. And when we ask people, why do you think there's twice as many women that have depression as men? And the women always say, it's because the men are making me depressed. But the real reason is these are the mothers who are taking care of children, running the home, and so they're more likely to seek help sometimes than men are. And as family members, I have 2 members of my family with mental illness. My husband has major depression and obsessive-compulsive disorder, and my daughter's been diagnosed with major depression and anxiety disorder. And as family members, sometimes we, like the rest of the world, to think that we're doing okay, and we don't often share information with other people around us. My husband was actually ill for 25 years before he sought any help. And many people that asked me, well, are you married? And I said, yes. And they said, well, we've seen your wedding ring, but we've never seen your husband. So a lot of times that's something that people don't talk about. And it's especially difficult if the person in the family who has a mental illness is not willing to seek treatment, and that was actually the case with my husband. He was a physician, and he was a radiologist, and he read his x-rays over and over again, and he washed his hands a lot, and they just thought he was a wonderful doctor, when actually it was his obsessive-compulsive disorder actually kind of fit pretty well with his profession. But at home it was a different matter. He was angry a lot of the time, and anger is also a sign of depression. That's not something that you often hear. And what was actually happening, I thought he was just acting that way because that's exactly how his dad acted. And when I thought back on it, his father was taking some antidepressant medication as well. Through the years, he steadily got worse. It got to the point where it was very difficult to get him to go to work. He didn't want to leave the house. I'd practically have to shove him out the front door, and I'd look out the window, and there he'd be standing on the porch. At some point, the hospital where he was working was bought out by another corporation, and he lost his job. And at that point, he became even more depressed. And it got to the point where he literally did not leave our home for 7 years. He would stay in the bathroom or the dining room. He said those were the 2 rooms where he felt the most comfortable, and he looked at his hands all day long because he was afraid his hands would become contaminated. And finally, after about 25 years of going through this, I said, you have got to seek help. This is not fair to you, me, or our children. Finally, he decided he would get help, and when you call to get an appointment with the psychiatrist, it's about a 5 or a 6-week wait. Well, that makes it really tough because the person is ready to go, and the services sometimes are not available. We were able to get in to see a therapist, and she was able to see us in a couple of days, and it was just amazing how much that therapy, along with medication, actually helped all of our family. We went to therapy once a week for 2.5 years, and I can honestly say it's the best money we ever spent. It was very helpful for us to learn about each other and what we were going through. At the same time, NAMI came along. They had a free 12-week course that's for people who have adult relatives with a mental illness. And I signed up for that course, and I was just amazed at how much information I'd gotten. I have a nursing degree, but there was a lot of things they definitely did not teach you when we were in school. The course was very helpful to me, and I continued along, and we started a family support group, so we have that available for people now. And now we have programs that we teach to line staff at mental health facilities, and we have support groups for people who have mental illness as well as family members. We've got some sheets over on the table that have all of our services on there. My contact information is on there as well, and you're welcome to ask me any question that you would like as well, and contact me anytime if I can help you. My daughter was also, as I said, was diagnosed with major depression, and she wanted to try talk therapy first. She was in the Honors College at USC and had a counselor there who was getting her PhD, and she did very well with talk therapy. When she got out of college and went on to get her master's degree, and was living in Arlington, Virginia. She became depressed again. She'd broken her arm very severely and was trying to get help there. Once again, talk therapy worked for her. It's really important to get that diagnosis, get professional treatment, and then you can decide with the proper professionals what is the best course of treatment for everyone. So we encourage family members. Sometimes, as I say, it took my husband 25 years to agree to seek treatment. The important thing to remember if you're a family member is even if your relative doesn't want to get help for themselves, you can always take care of yourself and get help for yourselves. So thank you.
There are a lot of places, not as many as there should be, I think, but there are many places that you can seek help and treatment for depressive symptoms or mental illness. There are private practitioners in the community. There are hospitals. There are clergy that you can seek guidance from. I want to talk to you about the Mental Health Center here in Anderson. The Mental Health Center has actually been in existence for 52 years, and it started in a little house not far from here on Main Street with a psychiatrist and a receptionist and one therapist, 3 people. And now we have 135 staff in 3 different counties. One of the things, as Michelle was talking, that it reminded me of is that it's very important for us at the Mental Health Center to make access to treatment as easy as possible. Because as Michelle was talking about her husband, if you contact the Mental Health Center and you're told, well, you can't get an appointment for 4 weeks or 6 weeks, you can't see the doctor for 3 months, that's incredibly discouraging, and a lot of people are not going to follow up with that. So we really do strive to get people in as quickly as we can, and I want to talk to you about how you can access services through the Mental Health Center. In Anderson, we're located on McGee Road, where a lot of the agencies are in the road, just off of Whitehall on McGee, and we're across from the UPS office. If you or a friend or a family member needs help with any type of depressive symptoms or any type of emotional or mental illness that you suspect, first thing that you should know is if you're having depressive symptoms and they're very severe and you feel like someone is at immediate risk of harm, if someone is suicidal, if you think they're going to hurt themselves, if they have access to a weapon or they say, I'm going to do this, you need to call 911. You don't need to call the Mental Health Center or anybody else. You need to make sure that the person is safe. If you're having symptoms that you're concerned about, whether they've been 2 weeks, 2 months, 2 years, but you're getting to the point, this is not me, this is not the way I want to feel, this is not the way I'm used to feeling, call the Mental Health Center. We're open from 8:30 to 5, Monday through Friday. There's some brochures over on the table here. They have our contact numbers. What will happen when you call the Mental Health Center is that you will be put through to a therapist to talk to. You're not just going to talk to a receptionist who's going to say, give me your information and I'll call you back with an appointment. You'll talk to a therapist. You can talk about what kind of issues you're having, and that therapist will decide and help you decide, do you need to come right in that day? Can you make an appointment to come in a couple of days? What we try to do with everyone who calls that's not an immediate crisis, we try to get them in between 2 and 7 days to see a therapist, to do an assessment. Do we always do that? No. But that's what we strive for is within a week.
I have a question for you. All right, I had to do that medication for about 5 months. I know that sounds like that's kind of a little bit like unbelievable, but I've had to do that 5 months before 5 months before I ever got it. Finally, I got the medication. Well, now with my counter medication is lower than what I was taking then. I know where my sleeping is going from, say, all night to, like, but basically what y'all talking about, well, just between 3 and 4 hours. Between 3 and 4, that's it. I mean, I'd wake up, get in the middle of the night, and I have to, try to fight to go back to sleep. And sometimes I would wake up again about 5, and it's just like a toss-turn situation. But 5 months, the reason I said 5 months was authorization for me to even get him on medication, I'd have to do with that. And so finally, I said, well, wait a minute, I said, well, wait, who can I talk to? I called out there, who can I talk to about the medication I need? And they said, well, we don't know who the next doctor's gonna be. That was the accusation that I got. But what I'm saying is, I'm not trying to put y'all down, I'm not. I'm trying to say that now that I am getting the medication, it's helping some, but it needs to be, maybe like a higher grade or something that would make me sleep a little better than what I was used to. And the only reason I said that, because there's probably a lot of people who probably with the same situation, like, that maybe their medication is a lower grade, it's not helping them to, feel aggressive enough to, understand what the, medicine actually supposed to do.
Right. And you bring up two very good points that I want to say something about. One has to do with pre-authorizations. And as healthcare gets more managed, it is more and more difficult to get authorizations for certain types of medication. And staff do spend a lot more time with that. And that can be difficult. You're absolutely right. The other thing that you mentioned that is a constant problem for us at the Mental Health Center and really across the country is the very small number of psychiatrists that are available to provide care. It is very difficult for us to recruit psychiatrists at the Mental Health Center, and many times we'll get temporary agency psychiatrists to fill in, and I think that's what you're experiencing when you see one doctor. You come back the next time, you may see somebody else.
Right.
And that's not the best treatment. I'll be the first to agree with you. We really do work hard to try to keep our staff as stable as we can and long term, but those kind of things are going to happen. But it sounds like you've been very assertive and active in your treatment, and I think that's a key
I have, yes, I've been
to
trying.
following up with it. If you can't get assistance from a case manager at the Mental Health Center, or you feel like you're not being able to get into the system quickly enough, I would like for you to call me.
Well,
And my name is on the brochure, and I'll be glad to assist with
Wait,
that.
one more thing now. See, I also had another case, and, he went somewhere else, and the doctor, he quit, it was all at about the same time, so you understand what I'm saying?
Bad timing,
Well,
bad
you're
timing.
not joking, and, they
Right.
didn't know when I was gonna see another doctor, and they didn't know when I was gonna get another, caseworker. Well,
Right.
now I have one now, she's out in Greenville, South Carolina, with, Regional Mental Health America.
Mhm.
And, now that I've transferred everything now back to Anderson's where here to start with anyway, it'll be my first time. But anyway, I'm getting the treatment that I need now. But the doctor, I think she's fixed to quit now, so I'm kind of going to get another, kind of a toss turn situation, because I think I understood it when they called me last week, that I think she's quitting sometime either, sometime next month, I believe it is. So I'm gonna have to kind of, it's gonna be kind of a toss-up situation again, I reckon.
Can you speak to that issue as to why there is a problem with retaining psychiatrists and recruiting psychiatrists? And it's my understanding, am I correct, there is no child-specific psychiatrist here in Anderson County? Am I correct with that?
That's correct, and Sarah, you can help me with this, jump in at any time. There are a couple of issues, particularly for the Mental Health Center. One is the number of folks that are going into psychiatry, and there just aren't enough psychiatrists nationally. The other issue that's more particular for the Mental Health Center is we're a state agency. We're funded by taxpayer dollars and federal funding. Our salaries are not competitive with a lot of other providers. So it's difficult for us. We have to make the case, this is a great place to live, and it is. If you have a family, you can work 8:30 to 5 at the Mental Health Center. You don't have any on call. But it's a great lifestyle. It depends on what the physicians are looking for. But we cannot pay as much as private providers, the VA, and others. So those are the two issues for us, in particular with psychiatrists. Now, as far as I know, we do have 2 psychiatrists that are going to be fairly long-term in Anderson. If you know something about, one of them, you know more than I do. I don't think she's going anywhere, so, I hope that they're gonna be able to, give you some continuity of care, 'cause that's what you need.
Could you speak to the cuts in funding for
Sure.
mental health?
We underwent some very severe cuts starting in 2008, when the economy went into recession. And everybody experienced that, but state agencies in particular were cut. We receive about 52% of our funding from the state. And from 2008 to about 2010, our state funding was cut by 40%. So what that translated into, we went from a budget of close to $12 million to a budget of $8.7 million. We went from a staff in 2008 of 184 staff for the 3 counties to a staff of 125. In the last 2 years, we've seen a good bit of that funding restored. Not all of it, but I'd say about half of it has been restored to us. And we have been able to add additional staff, and we have been able to look at expanding some of our programming. But quite frankly, that funding hit us extremely hard. In fact, we were proud, several years ago, National Alliance on Mental Illness ranks the states, on several different measures of quality of treatment for mental illness. And in South Carolina, we were ranked as a B, I think a B minus, which is one of the highest rankings in the country. And after those budget cuts, we got a D, which a lot of states did, and it was purely because of the lack of funding and being able to do. But that funding's coming back, slowly but surely, so we're optimistic at this point that we can do more things for more folks. Let me tell you just real quickly about accessing services. Call the mental health center, walk in, come to the mental health center. If you feel like you're in crisis, get somebody to bring you over. A therapist will talk to you. You're not always going to see the doctor the first visit. That doesn't happen. In fact, it's very unusual for that to happen. But we try to get you an appointment to see a doctor. In Anderson right now, I think we can get an appointment within a couple of weeks, 2 to 3 weeks, to see a psychiatrist. If you have problems at night or on the weekend, call the mental health center main number. It goes to an answering service. They will contact a therapist who's on call, and that person will call you back usually within 5 or 10 minutes, and they can talk to you in the middle of the night, on the weekends, on holidays, help you figure out what it is you need to do. So we're accessible 24/7. We're a state agency. The last thing I'll mention, there is a misperception, I think, that because we're a state agency that our services are free. I wish they were free, but they're not. There is a charge for service, and it typically depends on what your ability to pay is. So don't be discouraged if you feel like you can't afford services at the mental health center. Come in, talk to a therapist, talk to our financial folks about what your situation is. How many people are in your family? What's the total income? And if there's a need, that fee can be adjusted. So I want to make sure you know it's not free service, because if most things that are absolutely free may not have that much value. There needs to be some investment in it. But we don't want folks to stay away because they feel like they can't afford it. We'll work with anybody to make sure that that happens.
All of NAMI services are free, and it really is, that's
And it
one of
is
the-
free.
There's an exception to every rule. Everything we do have is free, so, and it's, the thing, comments I get the most often is, this has saved my life, or it's changed my life. So if you need our services, let us know. We would love to have you with us.
Yes.
I had a couple of questions, maybe I can tie it into what, in light of something you said. We used to have in this town something called crisis intervention. Have you encompassed that, or where did it go?
I'm not exactly sure
Okay, well,
what you're referring too. I think I know.
Crisis ministry.
Crisis, talking about crisis ministry.
And they ran a 24-hour crisis line, did they not?
Yes.
They did, and they ran our crisis line for a long
Right.
time. Yeah.
Because something you said is interesting to me. I had a student once who called me and she said, I'm gonna commit suicide. And I said, Linda, you need to call crisis intervention. Will you call for me? And I didn't, they said that person has to call themselves. Well, I just felt helpless. But then something you said, if you feel suicidal, to call your office. And I've heard before, and I guess it's wrong, I've been told, somebody says they're gonna do that, they're not. So that's a fallacy.
About suicide, that's an absolute fallacy.
I've heard that a number of times.
Yes, if somebody is talking about it, then you need to pay close attention and get them help and get them to talk to somebody about it. It's also a fallacy that if you talk to somebody about suicide, it will make them think about suicide and more likely. That's not true either.
Hey, so say that happens again to me. Do I say I'm gonna pick you up and I'll take you to you? Or what should I have done?
Call
It
911.
depends on the relationship you have with the person. If you're not at that location and you feel like you're at risk, absolutely call 911. If the person is with you and you can get them to go to a safe place, to the emergency room, to the mental health center, you can certainly do that. But I think the best thing you can do is call 911 and get them.
It got very convoluted because it was a student-teacher relationship.
Right.
But
Yeah,
I spent a miserable night until I saw her online the next day, you know?
right, right. Yeah, don't hesitate to call. Call 911. They're happy to come out, even if it's nothing. It's better for them to come out than it is for something to happen. And don't hesitate to talk to somebody about their suicidal thinking. And it is absolutely not true if somebody's talking about suicide, that means they're not really thinking about
I
it.
have heard that so